So with preventing and treating rubella, as far as treatment, there's nothing that can be done in regards to treatment. Honestly, if someone has postnatal rubella, the signs and symptoms are relatively minor without any type of complication, so there's no need for treatment. Most individuals will make a full recovery without any type of medicine. Like I said, most of the predominant sign associated with a rubella infection is that flat pink rash that typically resolves itself within 3 days. So no need for treatment there. And unfortunately, in cases of prenatal or congenital rubella, there's nothing that can be done once it's passed to the fetus. At that point, it's just waiting until the baby is born, and then obviously there are therapies that can help with things that are a result of abnormalities from the rubella infection, but there's nothing that can be done to kind of treat it in utero. Since there's no treatment associated with a rubella infection, everything goes into preventing someone from getting it in the first place, which again, it all comes back to that MMR vaccine. That same vaccine that was used to prevent measles can be used to prevent rubella. So the MMR vaccine is again given in several doses during childhood, and then it typically provides lasting immunity, often well into your 20s on average. But again, you should always get it checked, especially with this if you're thinking about conceiving. You always want to get your titers checked to make sure that you're still immune towards rubella, because you would not want to contract rubella in that first trimester of pregnancy, because it could lead to some of the abnormalities that we talked about. So prevention is through the use of the MMR vaccine. All right, so that kind of covers our macular-papular rashes, which were measles, which produced a red rash, and then rubella, which produced that flat pink rash. There are also other types of rashes, vesicular and pustular rashes. So a vesicular rash would be a rash that produces lesions filled with clear fluid. And one of the primary examples that we'll talk about with this type of rash is chickenpox and shingles. Both chickenpox and shingles produce lesions on the skin that are filled with clear fluid. Then there is a disease that's no longer around. It has been eradicated, but this disease was smallpox. This disease produces a pustular rash, which is basically a rash where there are lesions filled with a pus-like fluid. So we see a more pustular rash pictured here for cases of smallpox, and then down here this is a more of a vesicular rash common for something like chickenpox and shingles, which we would expect for a vesicular type rash. So we're going to talk about these specific diseases in more detail. So the first, chickenpox and shingles, both of these diseases are caused by the same virus, which is the varicella-zoster virus. So it is one virus that is responsible for two different diseases. The disease course is a progression. So when you first become infected with the varicella-zoster virus, you get a disease known as chickenpox. Then the virus goes dormant. Typically it goes dormant in the nerves, and where it could potentially stay dormant for the rest of your life. But in some individuals, when they become immunocompromised later on in life, the virus can come back out along the nerve pathway and lead to a second disease called shingles. But it is a progression. You have to get chickenpox first, and then later on you can progress to getting shingles. As far as transmission, it is predominantly spread through respiratory droplets, so it is highly contagious. Someone that has either chickenpox or shingles will be shedding the varicella-zoster virus, which could be transmitted to someone else through respiratory routes. But then also, both chickenpox and shingles produce vesicular lesions, so those lesions will be filled with a clear fluid, and that clear fluid will have the varicella-zoster virus. So if someone comes in contact with the fluid from an active lesion, whether it be chickenpox or shingles, the disease could be transmitted that way as well. So many of you may not know much about chickenpox. There was a vaccine created in 1995, so if you were born after 1995, you probably never experienced chickenpox, but I was born well before 1995, so I did experience chickenpox. Chickenpox in my day was something that every child got. They actually would have chickenpox parties where if one child got chickenpox, they would want to expose all the other children to chickenpox so you could have, one kind of big outbreak all at once and not deal with kind of sporadic outbreaks throughout time. But it was very common for children to get chickenpox. It is a highly contagious disease, but luckily it is a relatively benign infection, meaning it's a very minor infection, no complications, and most individuals make a full recovery without seeking any type of medical attention within just a few weeks. So when you get chickenpox, the primary sign that you'll experience are these fluid-filled lesions that kind of crop up all over the entire body. Some children were really lucky and they may only get a few lesions on a specific part, but most individuals that contracted varicella zoster and got chickenpox would have the lesions all over their body. And they weren't painful, but they were incredibly itchy, and the main thing you had to avoid was itching them, because if you itch them, you could break them open, and that creates portals of entry where bacteria could get in and cause an infection, and then obviously that would need to be treated with antibiotics. So really it was just not itching these lesions on your skin that were typically there. I mean, average of 2 weeks, but some individuals had them less, whereas some individuals had them a little longer, but typically about 1 or 2 weeks is what we would expect for these itchy lesions to be present. But eventually they would heal over. There would be no scarring since the virus targets the outermost layer, the epidermal layer, which regenerates itself, and children would make a full recovery without complications. And in your mind, you think that's it. You don't have to worry about the varicella zoster virus ever again. But unfortunately, the varicella zoster virus, which causes chickenpox, is a herpes virus. So once you become infected with it, you never really get rid of it. So while the lesions would heal, the virus itself actually travels to the nerves and is going to embed itself into the DNA of the sensory neurons and is actually going to establish dormancy there. So while the lesions are gone, varicella zoster virus isn't actually gone. What is going to happen is it is going to stay dormant in the nervous system. So I had chickenpox when I was a young child. Right now I still have the varicella zoster virus in my body. It is dormant in my nerves, essentially waiting for the right opportunity to come back out. And for varicella zoster, the right opportunity would be a time when I would be immunocompromised, when my immune system drops below a critical level, whether it be from stress or age or pregnancy or another infectious disease or diabetes or whatever it be. Once the immune system drops below a critical level, the virus sees an opportunity to come back out. Now, when it comes back out the second time, you're not going to get chickenpox again. Unfortunately, you get something called shingles, which is much more painful. So we have to talk about how shingles is different from chickenpox. So one of the main differences is the discomfort level. When someone has chickenpox, it's not particularly painful, it's just more irritating because it's very, very itchy and uncomfortable. However, with shingles is associated with the nerve pathway. So shingles, while it still is itchy, it's much more painful than what would be expected with something like chickenpox. Another difference is the length of infection. Chickenpox, on average, most individuals will recover between 4 to 7 days. Certainly some are a little bit longer, but on average, most individuals recover from chickenpox within 4 to 7 days. With shingles, on average, it takes about 2 to 4 weeks for someone to recover. I've seen individuals that have had shingles outbreaks for months, though. So some individuals, certainly the outbreak would last much longer. But the rule is, regardless of time span, shingles last longer than chickenpox does. The lesion type is different. A chicken pox rash is more systemic, meaning it would be present over the majority of the body, so it just spreads throughout the entire body. Whereas a shingles lesion is more localized, so it's typically isolated to one specific area. Most individuals that get shingles, because of the pathway that the virus establishes dormancy in the nerves, most individuals will have a shingles outbreak that kind of wraps right around the abdomen. But certainly not all. I've seen individuals that have a shingles outbreak on their hand, a shingles outbreak on their neck, potentially on their face, around their eyes, maybe just a certain area of the leg. So they can be in different places. All the most common, again, is to wrap around the abdomen. But the primary thing is chicken pox lesions are systemic. The lesions are all over the body, whereas shingles, they're localized to one specific spot. And then the last difference is the occurrence. So chicken pox, it's one and done. You only get chicken pox once, and then the virus goes dormant in the nerves. Shingles can happen over and over and over again. So every single time your immune system drops below a critical point, the varicella-zoster virus sees an opportunity to come back out along the nerve pathway and cause shingles. So shingles can be repetitive throughout your life, unfortunately. So as far as prevention, they did, again, create a vaccine in '95 to protect individuals from varicella-zoster. So children nowadays get vaccinated towards varicella-zoster, protect them from getting chickenpox. There's several routes for this vaccination. So a child could get Varivax, which is a vaccine that would just protect them against the varicella-zoster virus, or they can get it as a combination with MMR vaccine. So that particular vaccine, Proquad, would protect a child from measles, mumps, rubella, and varicella-zoster. And then they would get multiple doses of that. And then typically, once someone gets older, the cutoff right now is 50. It has changed. It used to be 55, now it's 50. They would typically want to get a booster vaccine, Shingrix, to prevent one from getting shingles. So even with me, I've had chickenpox, but once I get to 50, I would want to get a booster, basically to increase my immunity against varicella-zoster, to lessen the chance that I would get shingles. And even individuals that never had chickenpox because they had the vaccine when they were a child, still important that they get boosted at 50 again, because you want to keep that immunity strong so they don't potentially ever get chickenpox, which can ultimately lead to shingles. Some individuals can get this vaccine much earlier in life if they are someone that has a weakened immune system that would make them more susceptible to shingles. As far as treatment, with something like chickenpox, it's self-limiting, so you'll typically recover no complications within a week or two. So that technically really doesn't need to be treated, and the only case it really ever is if a child is scratching and breaks open a lesion that could potentially get infected, then it would get treated with antibiotics just for the secondary infection. In individuals that have shingles, there is antiviral drugs such as acyclovir that can be used to not completely get rid of the infection, but shorten in the infection and make it much milder. So in individuals that have shingles, what they will typically do in those early stages of the outbreak is they will put the patient on antiviral medication. And like I said, you're still likely going to have the outbreak, but it will be a milder, kind of smaller outbreak, and it'll last for a shorter period of time, maybe just a week instead of several weeks, as they tend to last like on average 2 to 4 weeks. So that can be used to kind of shorten the progression of the infection.